Okay. Along the same line, some of the myths that we'll talk about with regards to dyslexia come from the history of the label. So there was a reason why at a point in time we thought this was a visual impairment because of the history of it. So it's important that you know that, primarily so that you can defend dyslexia as a phonological impairment, so you know kind of where it came from and not just like, oh, I don't know why people say that as a myth. I don't know why that's a myth. You can actually tie it back to the history. But so we'll talk about it more as it applies to the field of SLP, and we won't go into too much detail. And then an evolution of the diagnosis, because there's been some crazy names applied to dyslexia, but we've kind of settled on dyslexia at this point. Then we'll talk about dyslexia as it compares to other reading impairments, and then your role in assessment and treatment. And we won't, we'll talk about a little bit of what we talked about last time just as review, but a lot of it will be how you can be involved in literacy assessment teams, and if you were to be working in a school or working in a preschool or working in an educational-based setting, how you can contribute your skills to that team. So, to start us off, this is a quote from Louisa Moats, who is not an SLP but has done a lot of really great work in the field of education, connecting speech and language-based skills to reading. And so she's got this training program called Letters, and I think it's, I should have looked that up ahead of time, but it's language for English teachers of reading and spelling or something like that. And it's for educators, for general classroom educators and special educators, to learn the connections between phonemes, phonology, and language, and a lot of the comprehension pieces too. And so she's done a lot of work on kids with dyslexia, and I love her definition of it, which is it's a one-of-a-kind language-based problem that can fall anywhere on a spectrum, just like many of our disorders, from an annoyance to a severe limitation. So another really important thing to remember about dyslexia is that not every kid with dyslexia or every individual with dyslexia is cut from the same cloth. So we're going to see some individuals who are mildly impaired or possibly even subclinically impaired. It affects more than reading is a huge piece. We talked a little bit about that last time, and we'll go into some details today. But there's really, as we talked about last time, even adults who have compensated have difficulties with spelling, have difficulties repeating multisyllabic words. So it's not just reading. It is, and it's because it's a phonological deficit that those are areas of concern. It's more common than any other learning disability, and I'm certain that regardless of what your background is, before you walked into the doors of Emerson, you had heard of dyslexia, yes? It's very common, it's very well known. The surprising part about that is, as common as it is and as well known as it is as a term, there's so few people that truly know what it's comprised of and how it affects life. And the wonderful thing about it is that it responds to expert-informed instruction. So we know how to provide compensatory strategies for these kids and these adults. So we know exactly what the problem is. We know it's a phonological deficit. As a result, we have a lot of really great phonological-based reading programs that can help these individuals. So it's not curing dyslexia. It's not making dyslexia go away because it's a neurobiological disorder. But it is giving them the compensatory strategies they need to be successful. And that's huge. There's a lot of things in our field we can't say that for quite yet. So this is a really big part of our field for that reason. So some common misperceptions of dyslexia. One we talked about a little bit last time is that the most common feature is seeing letters backwards. And so I think this is a funny cartoon. What do you get when you cross an insomniac, agnostic, and dyslexic? Anyone know all these words? Someone who stays up all night wondering if there's a dog. So that's untrue. They would definitely still be wondering if there's a God if they're agnostic. But if they're dyslexic, it would not turn into a dog. So it's not the most common feature that seeing letters backwards. That's not what happens. It's not a visual-based problem, and we'll talk about that in a little bit. But this is definitely the most common misperception of dyslexia, and one that if you take anything from today, only one thing from today, please let it be the fact that you now know dyslexia is not reading letters backwards, and that it's a phonological-based deficit. And take that out into the world and share it. Individuals with dyslexia are gifted. This is also a myth. Of course, there can be any individual with any sort of deficit in one area and a savant-like strength in another area, so it's not impossible, but as a group, this is not the case. We do normally see normal cognition with these folks, so we can, we'll talk about in a little bit, the IQ discrepancy and how it applies here, but we normally see normal IQ with these folks. So it's not that they're gifted, but in comparison to their reading abilities, they do have normal IQ, but not, Mensa kind of IQ. Dyslexia cannot be diagnosed until a child has been in school at least 3 to 4 years. So that's not true either, because even little kids can have dyslexia. Of course, this is a joke. But of course, if you have dyslexia, because it's neurobiological, it's something that can be diagnosed earlier. We just haven't found the greatest tools to do that quite yet. But as we'll talk about, there are a lot of features that we see that are early warning signs of dyslexia, one of which being genetic predisposition. So if you know that an individual has a history, family history of dyslexia, that puts them at risk. That's something that we can identify in these kids a lot earlier. So it's not the case that we have to wait till 2nd or 3rd grade to identify. Is your question? Okay. Oops. Don't look at that one yet. Oh no, what did I do? Okay. So the myth here, dyslexia cannot be diagnosed until a child has been at school at least 3 and 4 years. We'll talk about how dyslexia is diagnosed, and the aspect of this that is true is that a lot of the common measures don't identify difficulties with word reading until a child is older, because we want to make sure we've given them the experience of being in school and being taught how to read. And so testing a preschooler wouldn't necessarily be fair, because developmentally we don't expect them to be able to decode words yet, and they haven't been instructed how to do so either, so we want to make sure that we've given them that opportunity. But by the same hand, dyslexia is present at birth, and so there's things that we can do to kind of identify who's at risk and who's not. And finally, another big one is dyslexia is a visual problem, and things like colored lenses and eye tracking exercises and like kind of beer goggle types of lenses, different fonts will help, and that it's just simply not the case. It's not a visual problem, so that's not just not going to do it. Has anybody heard anything else along these lines or questions about these? Okay. It's been a weird week, hasn't it? It's so strange. Now it's Friday, and I'm like, is it? Is it really? It's so strange. I was here Monday, and then today, that's all. Okay, so this is the International Dyslexia Association, and I'm telling you that because they have chapters kind of all over the country. And if you are interested in dyslexia or interested in doing outreach work or anything, that's a good association to get involved with. I was involved with the chapter in Nebraska, and they would do really cool things like show documentaries about dyslexia or have adults with dyslexia come and talk about what their life is like. They would have a panel of experts come and talk about dyslexia. We had a showing once of the documentary and then a panel of experts after. And so it's just a really nice organization that does a lot of outreach and support. But their definition is that dyslexia is a specific learning disability that's neurobiological in origin. So again, this is not something that all of a sudden comes on. It doesn't have a sudden onset. If a child has dyslexia, they've always had it. It's just that the features and aspects and skills that are inhibited or in deficit because of dyslexia don't really come into focus until a child is older. It's characterized by difficulties with accurate or fluent word recognition and by poor spelling and decoding difficulties. So again, we've said this over and over again, but this is the official definition from IDA. These difficulties typically result in a deficit in the phonological component of language. So again, if you can think about some of the kids in our field, a lot of them have phonological disorders. So there could be some overlap with deficits that we see affecting more receptive phonology, such as phonological awareness and word reading. For those kids who have more expressive phonology deficits like speech sound disorders or childhood apraxia of speech or a phonological processing disorder. Secondary consequences, so this is if you can picture the simple view of what we talked about the past few, I guess just last time. Reading comprehension, breaking up into word decoding and listening comprehension, and if you remember us talking about the subgroups of poor readers and how those change over time, So a child who early on is identified as dyslexic can possibly later on be identified as a child with a mixed reading disability, because sometimes we'll see a secondary consequence of dyslexia resulting in problems with reading comprehension, and this happens because there's reduced experience with reading. So I talked a little bit about the downward spiral or the upward spiral for the self-teaching hypothesis, which we'll go into in a few classes. But the idea is that it's difficult for children with dyslexia to read. They have a phonological processing deficit that makes some aspect of word decoding hard. It might be letter-sound correspondence, it might be the phonological awareness piece, it might be sight word recognition, it can be all of them, so right, it's along a spectrum. As a result, they don't want to be involved in reading activities. Things that are hard for them, and this is a human nature thing, right? If something's really hard for you, in the sense that it frustrates you because you, despite how much you try, cannot do it, is not something that it necessarily beckons you, right? You don't want to keep doing something that's really, really difficult. And that's exactly what reading is for these kids. So as a consequence, over time, their comprehension skills don't maintain, and there's kind of a gap that occurs and widens. So while dyslexia doesn't just have a sudden onset, the comprehension piece can have kind of a sudden onset, because they could initially have good comprehension skills, but because they don't maintain that through reading and through practice and through that self-teaching hypothesis, their comprehension skills go down. So this is kind of a secondary consequence, but one to be aware of, because it can certainly impact the kids that you'd be working with, especially if you know early on they're at risk for dyslexia. They have like every red flag and warning sign you can think of in kindergarten, and then by 3rd and 4th grade they're not just struggling with decoding, but now they can't even comprehend things. You can make that connection and explain why. So continuing from IDA, the hallmark characteristic, of course, as we said, is the inability to read printed words in the presence of normal intelligence and adequate reading instruction. So it's not the case that they, went to a crappy preschool and were in a school in the school district that didn't pass the, whatever IDEA standards and whatever No Child Left Behind standards. It's not the case that it's not adequate instruction. Of course, those kids can struggle with reading as well, but that's not dyslexia. This is they have normal intelligence. There's nothing wrong with them cognitively. They've been afforded every opportunity to learn how to read, and yet they still can't. Does that make sense? And so some other researchers have referred to this as a word reading level disability, and that's exactly what it is. Difficulties at the level of word reading. So some history of this. So is there any questions? I feel like in a way I might be beating a dead horse, but maybe you don't feel that way. Are we clear on what dyslexia is and what it's not? Okay, so some of the history of that. So some of these names are amazing, but the very first name that was associated in the research with dyslexia was word blindness. And in some ways it's kind of true if you think about what we know dyslexia is now. It's a difficulty in reading printed words. It makes sense that word blindness would perhaps be the first term to be associated with that kind of disorder. And some other ones we've seen throughout history, not that any of these are, a lot of them are antiquated now and of course no longer used, but you will still see specific reading disability, especially in the schools. You'll see that used primarily because the school systems don't allow for diagnoses of dyslexia. And so often you'll see a specific reading disability listed. It doesn't say what it's specific in, but then that's where your assessment ability and assessment tools come into play, because you can do a test to find out, is it more phonological word reading or is it more comprehension language-based stuff. This is one of my favorites also, strephosymbolic. I think that's an amazing word that perhaps we should consider bringing back someday. I just think it's fun to say. But so if you see any of these names in your reading or looking through any old materials, then you can know that they're all synonyms for dyslexia. Yeah.
Why don't they allow dyslexia in the schools?
Dyslexia is a loaded diagnosis, and I know that each state and each district has different rationale for it, but it's so convoluted and so misperceived in the community that that's one aspect of it, that folks don't know what it is, and so saying that it's dyslexia means that they need this certain kind of treatment or this certain, the school's then responsible for paying for rosy-colored lenses, literally, in order to read text, and that's not what it is. And so really, I think a few things need to happen. One is the field needs to change to, influence the community to start adopting what the true definition is. But because it's such a loaded diagnosis, I think there's a fear of parents being litigious and wanting the school district to pay for all these kinds of services that are not necessary outside of what's going to happen in the school. One example that I can think of was a gal who I worked with who was probably in 4th grade at the time, and she was dyslexic but also had some other cognitive-based issues, so she had trouble with word reading, but she also had a lot of other things happening. So she had her parents took her for an outside evaluation. She came back with a report that said she had dyslexia. Just so you know, when you're working in the school district, you do not have to accept anybody's outside report. Those are not, you can look at them and you can include them in the file if the parent gives them to you, but they don't mean anything. So if they say that you need to see the child 4 times a week for 30 minutes, you can just say, good one, but no. So you don't have to, incorporate that because it's not an educationally based evaluation and didn't go through the whole IDEA steps and appropriate paperwork. But anyhow, so she had this evaluation, and that particular therapist or psychologist suggested the Orton-Gillingham method of teaching, which we'll talk about in a few slides. It's a great program. It costs I don't even know how much to train teachers. Our teachers weren't trained. I wasn't trained. But we know how to work with kids who struggle with word reading. I know how to work with a kid who's on my caseload who can't read. I know how to inform the teachers if I know specifically what's wrong with a child who can't read. I know how to, work in the classroom with the teachers. The teachers know how to, work with kids who can't read. The special education teachers know how to make adaptations. So it's not like we weren't treating her. We were providing the treatment, but the parents were insistent that we did this specific method. And so I think it's because dyslexia, it just comes with so much baggage that it's just something that they kind of avoid. IDEA also has 11 or 13 categories that after an evaluation you can diagnose a child with, and dyslexia is not on that list. So specific reading disability it is, and that's regardless of what the specific reading disability is. So there's specific language disability, there's specific math disability, autism, hearing impairment, traumatic brain injury, those types of things. But dyslexia and even apraxia of speech or anything that we would diagnose are not on the list. So all of our kids are diagnosed with speech and language impairment, which is another SLI acronym you might hear. But so yeah, it's a loaded diagnosis, and there's just not enough knowledge about what it truly is. And I'm sure there's lots of policy behind that as well. But so the first clinical research studies of dyslexia and of reading disability looked at adults with acquired disabilities due to trauma. So a lot of what we know about reading disabilities comes from folks who sustained brain injuries later in life as adults and then acquired difficulties with reading. So they had been normal readers and then something happened. It might have been a stroke, it might have been a TBI, it might have been some sort of insult to the brain, and then all of a sudden they struggle with reading. And so that kind of started us on the trajectory of, oh, okay, so there's parts of the brain, this is not an eye thing maybe, there's parts of the brain that are contributing